Happy to have with us here at ASCO 2012 Dr. Howard Kaufman, director of the Rush University Cancer Center right here in Chicago, Illinois. Doctor, thanks for being with us. What's it like to have the whole cancer community come to your backyard every year?
Well, it's very exciting. There's a lot going on in the field right now, and to have all the experts come into our town and to be able to interact with them and get the updates is very helpful.
Very helpful, but very hectic too?
It is hectic, yes.
Why so?
I think there's so many advances right now, so trying to keep up with everything is increasingly a challenge for us. And then it's an exciting time to try to think about new combinations of treatments and to sort of figure out how best to get the new drugs for our patients here. Gives us a lot of work to do.
Okay. Good problem to have, though, if there is one. You're here to talk about the current treatment of the landscape for melanoma. Are there any updates that you can give us involving the role of IL-2 in metastatic melanoma?
Yeah, so IL-2 is a drug we've actually had for melanoma for quite a while now. Interestingly, this is actually the 20th year anniversary of the first approval of IL-2. It was initially approved for the treatment of advanced renal cell cancer, and then in 1998 was approved for treating metastatic melanoma. The interesting thing with IL-2 is we've never really understood exactly how it works. So I think the advances have really been twofold. One is a better understanding of the basic biology of interleukin-2, and with that we may be in a better position to apply it to patients in a more predictable fashion. The other big news is that other immunotherapies seem to be working quite well in melanoma. Last year at ASCO, we learned that the ipilimumab had improved survival benefit for patients with melanoma. And this year we learned the results of a very large phase 2 study with PD-1 and the PD-L1 pathway, which seemed to also have a very good impact on patients with melanoma and renal cell carcinoma as well. So I think this really validates the role of immunotherapy for the disease. It also suggests, I think, immunotherapy might be useful for diseases outside melanoma, and I think has re-energized the interest in really trying to understand IL-2. We're very excited about the possibility of obviously combining some of these agents. There's some preclinical data in mice that suggests that if you combine the ipilimumab and the PD-1 inhibitors, that you can see an additive or even synergistic effect on tumor growth. We're just beginning to look at the effects of combining these agents with IL-2, and we're actually gearing up to do a trial of IL-2 with ipilimumab as what we think will be a much better combination for our patients.
When would you be doing that?
We're hoping to get that started really within the next probably 3 to 6 months.
You mentioned it's a lot to absorb, and you mentioned some of the things that you've seen here. What really has caught your eye or seems most compelling to you at this year's meeting?
Well, again, I think the PD-1, PD-L1 pathway as a cancer target is very important, and we will have to wait to see the results of randomized phase 3 trials, but that I think is very exciting. And then the targeted therapies continue to be an important theme throughout oncology and particularly pertinent to melanoma. So we are still waiting to see data on combinations of BRAF and MEK inhibitors, but there's a lot of buzz about that. And again, these are also agents that have yet to be combined with immunotherapy. And so I think that the future is going to be keeping us very busy. Just in the office talking to patients, I was talking to some of my colleagues, and we used to have fairly short conversations with our patients. And the good news now is the conversations are quite lengthy because we actually have a lot of new things to offer, and being able to put these in the right sequence and the right combination is something that we're just really at the threshold of learning.
Very good, Doctor. Well, we'll look forward to hearing from you next year about the trial that you're about to begin. Thanks for joining us again.
Thank you.
Dr. Howard Kaufman, director of the Rush University Cancer Center here in the host city of Chicago.